All right. Good morning. Welcome, everyone. Thanks for joining us today. I just wanted to include that earlier moment of remembrance for anyone in the 11 a.m. time zone. My name is Rebecca Bannicky, and I'll be presenting this webinar today. So I am a key account manager here at Tunstall. I've been here for just under 3 years now, started in customer care as an emergency response operator, moved into a senior position, and then earlier this year moved into being a team leader for the team. However, a few weeks ago, I've now landed myself a spot in the key accounts team. So my role actually involves working closely with our largest care providers and customers, helping manage all the alarm installations and monitoring for the clients and the residents, and hopefully solving any issues that they may have. Now, I'm particularly passionate about the experience that our clients receive when using the Tunstall service. This could be very crucial for the well-being and safety of our clients. So we always want to make the experience as positive and as easy as possible. So we'll get into it now. So this webinar series, we're going to take a look at our individualized solutions. So how we might customize the products and services that we offer here at Tunstall to those individual clients' needs, how it might best fit with their lifestyle or their living situation, and hopefully tailor that to their abilities and goals. So I'll tell you briefly about Tunstall as a company. So we're the leading providers of connected care and solutions and services. Been around for over 65 years now, first established in 1957 in the UK, and we've since expanded globally. So now we're supporting around 5 million clients around the world in operating in 18 countries. So huge effort and really proud to work for Tunstall. So our overall vision is a world where people have the freedom to live life to the full in a place of their choice. And our mission is to provide technology and services to improve our customers' ability to deliver new, more efficient and effective models for health and care management in the community setting. So we work directly with care providers, directly with end users, and using the technology that we have to deliver the services and support the people living within the community. So that brings us on to tailoring our service. So a lot of our clients have extraordinarily different needs. So we needed to find ways to tailor those services to fit those needs. One size doesn't fit all, as you know, which is why we have a product and services range that's flexible enough to meet the requirements of all kinds of people. So our team will offer products and services which match the needs of the individual, as I said. So from the outset, we wanted to reduce the barriers and make sure that the products and services that we offer are suitable for everyone. For example, falls detection is a popular feature for many of our clients. So it's enabled either with specialized pendants, with an in-home personal alarm alongside it, or it's enabled and configured with our mobile personal alarms, ones that they can wear out and about, out with the home. So this can be really valuable for people living with maybe epilepsy or prone to seizures and things like that, so they can feel safe when they're at home or out walking around, just living their day-to-day lives. Additional to that, Our in-home alarm pendants can be mounted on walls or in different rooms where the client may feel that they're at a higher risk, or in some cases attached to a wheelchair. And they're easy press adapters and alternative buttons, jelly bean buttons, etc., to make it easier for the client to activate if they maybe have limited dexterity. So we try and make the pressing of a button as easy as possible for all our clients, depending on what their use might be. We do also have blow switches available. So you can blow directly into it to activate an alarm in that sort of fashion as well. Additionally, we do have epilepsy mats. So say if someone was to be having an epileptic fit during the night or something of the like, it will shake that mat and it will make an alert that way. This all gives us the flexibility in how a personal alarm system can be set up for each client. Okay, so we have a 24/7 response center, so we can tailor the process post-alert to ensure that we reach our clients and arrange help as quickly as possible. For example, clients and their emergency contacts, loved ones can put in place specific requests around who is contacted in the event of an emergency and which order they should be contacted. For example, if someone is high risk, we may well contact emergency services first and then go ahead and reach out to emergency contacts following on from that, or vice versa. If they may just need a little bit of assisted care, we can call family members to come and assist first, and then contact emergency services should they be injured or require any further help. Our team will receive the alert, and if we can't directly speak with the client, there are specific steps that we take from there on out. Typically, if the client is maybe non-verbal, we may be able to send them a text message, or if they're hard of hearing, we can send them a few text messages first, and then if we get a response, we can act from there. If we don't get a response, then we would follow that individual client's procedures on how to act in that specific event. Commonly, we'll have maybe a next door neighbor contact number. So we'll receive the alert. We're unable to speak with the client, so we'll contact the neighbor to go over and make sure they're safe and well. But otherwise, we generally assume that someone needs assistance straight away and contact emergency services. But again, it all comes down to that person's individual protocol that we set up right from the very beginning. We get the client over. Now, if someone is living with a visual or hearing impairment, there's other things that we can tailor and put in place. We would typically recommend, say, a vibrating pendant that will confirm to the client if they're unable to hear or see it, that the alert has been activated. And we may configure the alarm to broadcast a loud noise if that would be helpful to the client. Or again, referring back, we can send them some messages or try and call the landline, see if we can make contact with the client first, if they're more comfortable communicating in that way. And then the order in which we notify emergency contacts can be defined and customized from there as well. So on those notes about tailoring specific products, we'll have a look at the Bellman and Symphon products today. So the Bellman and Symphon range, which we'll take a look at now, has been specifically designed for deaf people or those living with some level of hearing impairment. So the simplest description of these products is a range of specialized transmitters and receivers, which can be easily interconnected anywhere throughout the home. When a transmitter is activated, all of the interconnected receivers will then be activated. For example, if a door contact mat is stepped on, that pressure will then trigger an alert. If that is then connected to a flash receiver, it will start flashing brightly. If it's connected to an alarm clock, the alarm clock will maybe sound or flash accordingly. Or alternatively, you could interconnect a bed shaker so that it will vibrate and alert the client that the alarm has been triggered. We can also integrate some Bellman devices with our in-home alarms so that an alarm call is generated if a Bellman transmitter is activated, giving that client the extra coverage throughout the home. So a little bit more on the alarm clock. This is a great option for alerts in the middle of the night. So when an alert is received, it can be configured to either flash brightly, it will blast out a multi-frequency signal, or it can use the bed shaker to vibrate beneath a pillow. Any combination should ensure that no alerts are missed by either the client themselves or maybe if they have a carer or a family member staying with them at the time. One of those alerts should let someone know that help is required. And they also have push button transmitters. So they're little and portable, and they can be used to activate any of the interconnected receivers, such as the alarm clock or the bed shaker. Could be placed at the front door, could be right next to the bed, whatever is easiest for the client. And it can also be worn on the body with a lanyard around the neck. So the range of this transmitter is about 30 meters. So depending on the home environment and its use, they can generally cover anywhere inside the house or out in the back or the front yard within sort of 30-meter radius. All right. So I'd like to open it up to you and see if there are any questions at all on these products, and I'll try my best to answer. I'll just give it a minute or two. I know not everyone is a super quick typer. All right, I'll keep an eye on that, but just while I have you, I'll just answer a couple of frequently asked questions that we get often. So battery life for the Bellman devices is really good. So it does vary device to device or how often they're used, but generally at least 2 years of standard use. The devices use pretty standard battery types, AAAs, et cetera. So it's easy to swap over if needed. The next one, Bellman range is quite flexible. So generally it's easiest to describe your living situation or the problems you're looking to solve. And then we can recommend a particular setup which may suit and take it from there. So we're completely guided by the client and their needs, or the occupational therapist, what they think would be good for the client, given their specific situation. There's no questions. I just wanted to thank you again for joining us. If you do have any questions that you couldn't think of right now, that you may have moving forward, or want to inquire on behalf of your client, you can reach out to our team on the number below or by emailing ndis@tunstall.com. That's it for now, and we hope to see you in our next webinar. Thank you so much.